Hello, my name is Cindy Ronquillo and I'm going to talk about a dental size complications. First, the definition. A dental size, also called an odontogenic size. They are cavities that can be filled with liquid or solid material and covered with a scaly layer. Despite being a benign lesion with the passage of time, its size can increase, which can cause deformity in the area or even mobility in the teeth. Application in odontology. The cysts are relatively rare growths or lesions that form on the jaw or soft tissues of the mouth and face. The normal treatment of this type of pathology is the removal of the cysts, avoiding the need for the extraction of the affected tooth. If the cyst is attached to the tooth, the treatment should be evaluated depending on each case.
Of all treated root canals. However, standard root canal treatment does not specifically address this issue. During the standard procedure for root canal treatment, an apical patency up to file number 30 is applied, creating a passage through the apex into the periapical lesion. Then an apical stop is made by using a file number 40, positioned at 1 millimeter coronal to the apex. After a stabilizer is placed over the orifice opening, the first of two apexum tools, called the nitinol ablator, consisting of a specially designed nitinol blade concealed within a nitinol sheath, is inserted through the canal up to the previously created apical stop. The nitinol sheath is then cemented to the crown, and the ablator is pushed through and beyond the apex into the lesion. The ablator is now rotated at 250 RPM for 30 seconds, thus roughly grinding the lesion tissue while leaving the bony crypt intact. After removal of the nitinol ablator, a second tool, the PGA ablator, which consists of a bioabsorbable flexible filament, is inserted into the ground tissue and rotated at 5,000 RPM for 30 seconds, mincing it further to an even finer consistency. The PGA ablator is removed, and a 30-gauge needle is inserted through the canal. The lesion is now rinsed and flushed out with saline. Once the backflow fluid appears clear, the needle is removed. After the procedure, a standard root canal filling is performed. As demonstrated in clinical studies, more than 90% of lesions treated with apexum heal within 1 to 3 months. This enables restoration work to commence earlier than in current practice.
The pros and cons. The pros. The appearance of cysts can vary from person to person. By removing the cyst, we are able to avoid more complications in the future, such as ending up damaging the rest of the bone. And the cons, if the cysts are not treated or diagnosed in time, it could increase in size and displace teeth or even cause the loss of some teeth. And the treatment will be more complicated. It could lead to the extraction of a piece.
If left untreated, the abscess can possibly spread to other areas, causing severe consequences to your overall health. The infection usually originates from the inner pulp of the tooth and can be caused by tooth decay and dental trauma. As the infection spreads, your body forms a sac around it to attempt to contain it, which creates pressure and painful sensations. Signs and symptoms that you have an abscess can include a consistent throbbing toothache, fever, swelling of the face, gums, or jaw, foul-smelling breath, and pain while chewing. You may also experience a foul taste in your mouth if the abscess is draining pus. An abscess will not heal on its own, and if left untreated, the infection can spread to the jawbone and other parts of the head and neck. If allowed to expand, it can also weaken the jaw as it begins to resorb and replace bony tissue. Abscesses are very serious, so it is critical to work closely with your doctor to treat it as early as possible to minimize the potential for harm.
Issue applied in Ecuador. Reese, the Lopez team of specialists in a clinical committee indicate that the objective of treating a dental cyst will always consist of its elimination in order to avoid more problems. Treatment may involve different techniques depending on the type. For example, apicectomy or obturation to seal the tooth and prevent reactivation of the cyst. And the conclusion. The dental cyst is usually a consequence of the extension of an infection of the tooth and the bone in which it is inflated to adjacent areas. Thanks to an early diagnosis, it will be possible to avoid complications. Thanks.